Hi everyone, I'm Dr. Abdul Hadi Sharif. I'm one of the UG and PG examiner guiding many students at various levels like MBBS and postgraduate levels in various subjects like orthopedics and emergency medicine. Today, I should thank our Go campus for giving me an opportunity to help the students to pass an exam which is easier. Our mission is to improve the performance of students with least amount of time and efforts possible. Passing an UG exam is easier than if you pay good attention and how you prepare for the exam. I'll touch upon some important aspects embarking on the main topics how you should prepare for the exam. The exam per se should be prepared from the day you go to the course or from the academic year which starts. Okay, and then you as soon as you go to the academic year, plan yourself in best of the best way possible. It is a marathon. It's not like a sprint which finishes in a short period of time. You prepare the exam just before the exam is coming and then you vomit out everything. It's not like that. You have to start your running, your preparation from the day you start your academic year. Your everyday effort multiplies over a period of time and it will have a compounding effect. In MBBS, all the subjects knowledge is very much essential at the end of the time when you start treating your patients being one of the best doctor. There is a particular pattern to learning things and writing. This I am emphasizing because I have seen myself as one of the best candidate who has written the exams in multiple times and secured ranks and distinctions. So if you follow the particular pattern in which you can write the exam, you will secure the marks when compared to the other students in very high score. You need to understand this. There are some important questions which you must know to pass and some topics which you have to know to distinguish yourself to secure the highest of the highest marks and come out with a good colors in your hat so that you get ranks. So basically, as soon as you enter the academic year, start collecting the question papers, the question bank of that particular university and go through the questions repeatedly so that it should be in your second thought which questions are important, which questions are main questions, which questions are short questions and which questions are just an MCQ. As soon as you start reading the course, attending your classes and go through the topic, when you are reading the books, your mind knows which topics to be put in which one, like main questions, what or how much things I had to prepare. For short questions, how much I should prepare. For MCQs, like one mark question, which words are important. So all these things will be imbibed in your brain in small capsule so that when you go to the exam, you know what things you have to write and what the examiner is concentrating to give your marks. On the clinical side, do not memorize the answer just like that. Just fill the blanks in the following way. Understand the question what the examiner is asking. For example, in some questions he might be asking clinical features. In some questions he might be just asking what are the investigations which are necessary. So when you know the order in which you have to write, only that part of the question has to be elaborated. Do not deviate from the questions. Write diagram which are catching. If a person is not writing the diagram and the other person is writing the diagram, definitely the person who is writing the diagram will give more information in a glimpses of vision when compared to the other person. Always write in paras with subheadings so that the subheadings will give you what information you are writing so that the examiner catches it and gives you marks. The importance of handwriting cannot be overemphasized. If you know the flow diagram, like what treatment has to be followed after what, if there is a deviation, which path to follow, will fetch good marks.